our EMR is a tremendously powerful tool. It's not just an EMR. We have a vision that it can do extraordinary things for us if we apply it to some specific goals, if we use some of its capabilities. So we said in our presentation today, an EMR without a vision for what it can do for you is like a hammer without a nail.
And it's also like the bike without Lance Armstrong to ride the bike. So you need the tool, but then you need everything around it, the vision. If you use the analogy of Lance Armstrong, it's also the training, the people that maintain the bike. So it's very important to have that whole vision all together and not just replace the paper of the EMR.
The EMR can help you achieve very high levels of performance within very short periods of time if you use its capabilities. If you don't use its capabilities, if you don't have that vision for what it can do, you won't get that benefit from it. You'll be unlikely to really realize the promise that we think an EMR represents. Kathy is constantly working with us to show us, here's what the EMR could do for us. We're constantly working with Kathy saying, here's what it can do for us, but here's where it feels like it's doing something to us. So can you fix this piece of it? So we're constantly refining how we use it and trying to find advantage for our clinicians in its use. Parts of using EMR are a pain, frankly. Everybody knows that. But if we can find other areas where it helps me as a physician, for example, achieve extraordinary outcomes in things that I really want my patients to have, then I begin to feel like it's a partnership. It's an advantage. We've found, for example, that most of our physicians don't want to go back once they've started using it, but we have to constantly find ways that it helps them do better things for their patients.
It empowers the whole team. It's the whole care team. It empowers the performance improvement staff. It empowers the clinical specialists who work with the physicians. So it takes some of the work off of their shoulders because other people can do that work because the information's all there in the electronic medical record. I'd start by saying that it's a team effort. And so you work with what are your goals. So you have the executives and the goals, you have the clinical leadership, and then you have the IT folks, and we all work together to make sure that we are all in agreement on what we want to do, that we are all in support of the same vision, and then it's just a lot of hard work.
You absolutely have to commit resources to your clinicians, your nurses, your physicians, your nurse practitioners, your respiratory therapists as they learn how to use it.